name's Chris Gates. I work for a company called Valencia. We're based out of Texas, but we have offices in Colorado and soon to be in California as well. And I want to thank all of you for being here because normally we'd be doing it this way. I've gotten so tired of looking like that. I find I wear the same white shirts all the time just so I can patch things together if I need to have a video. So yeah, this is the normal approach. So why are you here listening to me today? What sort of credibility do I have? Well, I have been a medical device developer, mostly of class 3 medical devices for 49 years. I started very young and I'm very old now. The last 13 of which has been dedicated to incorporating and teaching cybersecurity to medical device manufacturers, MDMs. It's an interesting approach and it's different from IT cybersecurity, quite a bit different than IT cybersecurity. As a result of that, it makes me this strange hybrid of a developer and a hacker. And I've been hacking since college. And all during my career, I would not only employ it to protect usually a consumable part of our product or the intellectual property, but I also use it to attack our competitors, where I would take the competitors' products, reverse engineer them and pull out algorithms and look at what they were doing and how they were doing it. So this is extremely common today. So about 13 years ago, I was consulting at a very, very large, the largest medical device manufacturer in the world, and they were very publicly hacked. And I had the interesting time of telling them, well, I could teach you about this. And they're like, well, what do you mean? What do you know about it? He goes, well, you generally don't talk about this, but I'm a hacker. And I can explain to you what they did and how they did it and why they did it. So that started me on a really interesting arc away from being a normal engineer to how to incorporate cybersecurity in advice. More importantly, how do you incorporate it into your development lifecycle in a way that's manageable, produces the artifacts you need out of it, that you can look at it and look at schedules and anticipate and see how far you've gone. Not wait till the end of your development and have a real big technical debt surprise that you're not going to be happy with. So there was a lot of things that came out of it. This large company, I wound up contracting for 7 years there. And it gave me a great sandbox in which to try out ideas, try different approaches. Some worked, some didn't. I refined it. Then I started branching out and working with the FDA, standards bodies. Today, I work with NTIA and Software Bill of Materials, the Health Sector Coordinating Council, and the Contract Language Working Groups, right? IEEE. I'm about to fire up my own vulnerability scoring through HISAC. So there's been a lot of these groups, and FDA, of course, I'm always talking with them. A lot of these groups that I set up, and I try to advance our business in a way that's workable, something that actually provides value to a development, not something that's just a checkbox you have to do to get it approved and get your device to market. Do understand you need to have cybersecurity to get your device to market. It may be the best medical device ever. You might have revolutionized whatever field you're in. The FDA doesn't care. They really don't. It's here 2 months ago, I had a client come to me, a new client. They had submitted under a 510K EUA a purely diagnostic device that sat on your chest. You couldn't have harmed the patient unless the patient ate it, okay? And it used BLE to talk to the smartphone and then relay this information back to a medical device data system. There was 24 cybersecurity questions that the FDA pushed back on, okay? They're dead serious about this. And they're getting better at it. Used to be it was kind of uneven. You never knew. Hey, you could submit something and it could be a real risk and go in the surgical theater and they not even mention cybersecurity. Not now. One of the things Dr. Kevin Fu has brought to it when he joined here this year as the pro tem director of cybersecurity for FDA is a lot more uniformity across the board. And so that is really a good step forward. One of my things that always bothered me is I've been doing this for medical device, like I said, for a long time now. And for years, every MDM I worked with acted like, oh, this is a surprise. Oh, I've got to be secure? Really? So I'm on this personal 5-year mission to fix that in my industry. So the first thing we did is we created the first and only book on medical device cybersecurity. As you can see in the slide there. It was published through Artec Publishing. And Jason Smith, who also works at Valentium, we were working on this book to begin with, and we created an outline for it. We thought we'd go to a vanity press somewhere and have it printed, right? Not a real publishing house. Well, about that time, Artec Publishing advanced a friend of mine named Axel Worth, who just happens to be sitting in the back row back there hiding, and asked him, because he had previously written for AAMI, AAMI, he had written a cybersecurity book for the health delivery organizations, hospitals, clinics. And they said, hey, how would you like to do one for medical device developers? And he said, yeah, let me talk to my friend Chris. So we were literally on that Zoom meeting that you just saw. And he said, hey, how would you like to do this for me? They need an outline. And I said, hang on a second. And I pulled up the outline we already had. And that's actually what we submitted. And they came back and wanted 20% more content. And it was a great ride. We've got all sorts of contributing authors in the book, industry leading lights that are in there. It's really great. I would have had Suzanne Schwartz of the FDA do the forward, but the ethics committee took months to review the book. So I got Greg Garcia of the Health Sector Coordinating Council to do it. So great book, highly recommended. But this was the first step in my 5-year plan. The next thing is Valentium has stood up a 3-tier training system, which is what the shields are indicative of. So you can send your engineers to us, and we will take them through the process of making them cybersecurity experts. I don't want to do this for whatever remains of my career. I do want to retire at some point. I really do. And I want to make it so I can walk into any MDM, walk up to their staff engineers and start talking about cryptographic elements or how they're handling this or threat modeling, okay, their attack surface, and they're going to understand what I'm talking about, and they're going to come back and give me solid answers. Already I've seen this at work and at play. For instance, if I onboard a new client and he holds up the book and it's got a bunch of 3M Post-it notes, the conversation goes so much easier. He understands it all at this point. They're ready to go. They're ready to rock. So that's my personal quest. We're doing other things as well, shows and stuff that will be upcoming that I can't talk about yet, but all oriented around how to make our industry secure. So the company I work for, Valentium, as I mentioned, it's out of Texas, was founded by Tim and Dan. And so far we've done over 1,500 projects, 400 plus clients in 15 plus countries. And we actually doubled last year in sales. And we're on course to do it again this year. It's pretty amazing. 150 plus employees. We have other offices scattered around, one in Colorado, for instance. I personally work out of Las Vegas. And our mission is change lives for a better world. And you've heard mission statements from all your companies that you've worked for, and then they totally ignore them. They actually mean it here. We've had debates. I've handed back checks from clients that I didn't feel were honorable in what they were doing. And it's really impressive. We are there to help change lives for a better world. And if you're doing something that isn't, we're not really interested in working with you. So we have an interesting business model in that we're a puzzle piece. You can be a 2-man startup or the largest company in the world, medical device company in the world, come to us and they say, we need everything. We've got a concept and we want to take it to manufacturing and everything in between. Great, we'll do that. Or we need mobile apps. Great. We need production testing. Great. We need cybersecurity. Fine, we'll engage with you with that. So we have all these different pieces that we can fill in as you need. Likewise, firmware and device development and algorithm development and human factors engineering, all the usual stuff. We can do all of that. So we're an interesting company in that we're extremely flexible in what we're doing. And we're obviously extremely successful at it. So what are the risks? The risks are multifold and really quite different from an IT environment. For one of the things is they have access to your device 24/7, physical access. You don't let people walk through your server room. You have physical security around your servers for a darn good reason, all right? But yet your product is there completely at their disposal with all of the physical attacks that can be leveraged against it. And there are many that are very productive to wage against the device. All right? So you might lose your intellectual property that took you years of laboratory time to come up with. Literally, I can reverse engineer most products and pull out your algorithms in under 10 minutes. It's that bad. I have otherwise intelligent engineers tell me, well, once I compile my code, you can't read it. Okay, so part of that training I mentioned earlier is the first half of the day, I should go through and show engineers with all equipment that's under $20 and a few minutes of education. just how easy it is to reverse engineer devices. And that always opens their eyes and terrorizes them. I say, now go back to that project you're working on now. Take a look at how easy it is to use a side channel attack to extract that hidden key you think is hidden. Right? So there are things like that are out there. Now, obviously, the first thing you think of with risks is what all the regulatory bodies tell you, which is safety and efficacy. We don't want to kill patients. But really, what cybersecurity is about is your business model. Losing your intellectual property, that's a problem. You may go out of business. How does that help anybody, right? If you've got a toothpaste model where you've got a consumable and somebody undercuts you and counterfeits your device, or they format your device and re-release it to the market, this goes on a lot, by the way. Used to be a third world country kind of thing. Not anymore. Hundreds of millions of dollars here domestically are spent on taking someone else's product, refurbishing it, and re-releasing it out to the marketplace. So this gets into the whole concept of who's liable. Certainly it tarnishes the original company's reputation if something goes wrong. Is it safe to use? Is it still effective? You don't know because you don't have control of it. So all of these things are different. And by the way, yes, we do care about patient safety. That's bad for business. It's bad for PR. But we got into this business not to make money. Otherwise, we'd all be stockbrokers or something. So hedge fund managers. Well, we got into this to help people. We feel good about that. At least I do. I think of the hundreds of thousands of people I've kept alive that I'll never meet. With all the ventilator development I've done in my career, it's really a great thing to feel like, as opposed to, oh, great, I made the best landmine ever made. That's not something to be proud of. So we got into this to protect people, not to harm them. So there's a moral responsibility to this. Likewise, all of the regulatory bodies, certainly the FDA, but really around the world, have all gotten on board as well. They do it differently, but they're all on board. You need to demonstrate that you have secure medical devices. One of the things that's coming up, because I work with the Health Sector Coordinating Council on establishing templates for contract language, is that what the HDOs are going to start to use in purchasing and working with us as MDMs is stock contract languages. Some of that is, okay, you made this pole mount infusion pump, and while the infusion rate's fine and it doesn't harm the patient at all, it was used as the pivot point into the rest of my organization, and we lost $200 million because of that intrusion. Guess who's liable for it under these contracts? They're passing that liability back to us. It wasn't their fault. You made an insecure medical device that was used and weaponized to attack their platform. So they're looking for a neck to wring, and that's how they're going forward. This is the standard going forward. You think regulatory bodies are bad? Oh, no. This contract language and how we deal with our customers is changing rapidly, and it's not the way it used to be, where you could just kind of ignore them once the sales was completed. So there are some differences, again, between IT. And one of those is likelihood. We use likelihood as mean time between failure and all of these types of statistics quite well, and have for decades, for naturally occurring events like, say, rust. As you can see on the bridge there, we can predict quite nicely when that bridge is going to fall into the creek below it. But that's because it's a naturally occurring event. But if rust became sentient all of a second and said, wait a minute, I'm going to oxidize this one strut right here, forget about the rest of the bridge, how could you predict that? How could you predict the failure rate of that bridge? You can't. That's the same thing with hacking. When somebody is hacking, or there's malicious intent, those statistical averages just don't work. So mean time between failure, likelihood, they go out the window for you as a manufacturer. You as an HDO, there is a likelihood component. There has to be, what is your exposure? But that's a different thing. For us as manufacturers, we're looking at this as, what can I do during design and implementation time that can identify these vulnerabilities? So what do you care about then? You care about the severity of that. It's going to expose my intellectual property. It's going to allow somebody to clone my product. It's going to kill the patients. It's going to cause me liability. I'm going to have fines from regulatory agencies like HIPAA and GDPR. Okay? And also, you're worried about the exploitability. Just because I have a vulnerability there doesn't mean it's exploitable. So how easy is it to exploit this? In other words, if I can physically exploit it, walk up to one of them and pull that and harm the patient, Okay, I hate to say it, but a sample size of one patient that's dead isn't as bad as 50,000 that are dead, okay? It's a matter of scale. But by the same token, if I can walk up to one unit and pull all your intellectual property out, okay, that is bad, right? So different use cases, different abuse cases winds up with different areas of interest. But exploitability and severity, those are really the only two metrics you want to look at during your development lifecycle. So I used a couple of terms here, and just to standardize on the terms, in my industry of cybersecurity have done a horrible job of standardizing on terms. And one of the ones is threats that you hear thrown around. Threats, oh, it's a threat. I'm threat modeling, okay? Well, to be clear, as developers, what we are doing is we're looking for vulnerabilities. Vulnerabilities are a weakness in your product that can lead to exposure or subversion of confidentiality, integrity, and availability, the CIA triad. And those are things like, well, a hole in a fence. That's a vulnerability. Doesn't mean anybody's going to go through it. Doesn't mean anybody said they were going to go through it. That is a threat, okay? Doesn't mean anybody did it. That's an exploit. So what can you do when you have a vulnerability? Well, vulnerabilities are created at 3 different places in your development lifecycle. There are different tools and techniques to use to expose these vulnerabilities at each of those points. But they are during design, during implementation, and through the use of third-party software components. The traditional term for that, which I deplore, is soup, okay? Just the unknown. I used an unknown piece of code. I don't know, it was on the floor yesterday. I picked it up and I used it. No, you don't darn well what GitHub repo you copied it out of, okay? So third-party software components are much more descriptive. So it used to be, I'm an old guy, back when I started, we literally wrote all of our own code, first in assembly, then in C. Well, this has changed markedly over the years now, and these projects have gotten to have hundreds, and in some cases, like with JavaScript, thousands of third-party software components. So you have to use different ways to assess these components to make certain there's not a problem. So you have that vulnerability. What do? Well, you create mitigations. Not all mitigations are good mitigations. Bungee cords. Okay, it's going to slow down the guy going through the fence, but it sure isn't going to stop your attacker, right? In our industry, that would be roughly equivalent to obfuscating a mobile app. Do it. Obfuscate your mobile apps. It's one of the few things you can do on a mobile platform. I'm not saying don't do it. I'm saying don't spend a lot of money for that obfuscator program. I can show you a really good one for $1,200. There are some out there that are $90K and above. Don't waste your money. All of those can be undone through what's called a de-obfuscator that you can download at GitHub and return it back and then decompile it. It's great. But go ahead and do it. It'll slow down the script kiddies. But then what you really want to do is enact much better levels of security behind there. And that's called defense in depth, multiple overlaying mitigations that are there. Some that are better than others. By the way, I used to have a giant Rottweiler, but I found too many people came up afterwards and said, don't do this. That's scary. That's a scary thing. I was scared with it. It's like, okay, he's non-threatening. So a brief overview of the regulatory side of it. Back in 2014, the FDA kicked out the pre-market guidance for cybersecurity that said you must secure your device. We like unicorns, puppies are cute, and gave you no explicit guidance in what they really wanted you to do. Horrible disservice to our industry. I spent years going around proselytizing, saying, look, I've seen 483s, rejection letters, pre-sub-meeting minutes. Okay, I know because they're extremely pedantic about what they're looking for, all right? I work with these folks. I talk to them on a daily basis. I know what they want. But that guidance made them think that, oh no, it's all fuzzy and nebulous. It doesn't matter what you have. It does, all right? Then 2 years later, in 2016, they came up with the post-market guidance, a much more exacting document for what your responsibilities for once it reaches the marketplace and for the supported life of that medical product. That's a lot of work, guys. That's something new for this industry when that came out is really, we've got a lot of extra activities we have to do? Sure do. And in fact, that 2016 document has a number of veiled threats. When I asked Suzanne Schwartz of the FDA, I said, why did you write the 2014 guidance so badly? She says, we thought they'd get it. I said, no, that's the point of a guidance is to guide. Okay, you didn't. 2018 rolls around and they come up with a new version of the pre-market that's a much better document in the sense that the content is there and it lays out exactly what their expectations are for your submission. By the way, it doesn't matter what kind of submission, PMA or any one of the 15 different types of 510Ks, it's all the same. That includes EUAs and specials and everything else. Nope, they all want to see the same stuff. Doesn't affect it at all. So there was a couple of things wrong with that 2018 document. One, they used the 2014 format, which made the document close to unreadable. And then I know I filed some 30 odd issues with the document itself. The other one was the tiering system that's in there, tier 1 and 2. So they were trying to come up with some sort of a spectrum. It didn't work. So here before the end of this year, we're supposed to see version 2 of that guidance in a new format with basically the same content, except the tiering system is gone. It just applies to all the medical devices. No more tiering system. We're all in favor of that. It added a lot of confusion. So this new version, however, you can look at the 2018 content and with the exception of the tiering go, yeah, it's going to apply to me too. This is IDEs, by the way, guys, as well. If you do an IDE in the United States, this applies to you. You intend to reference a foreign IRB that was done somewhere, okay, and bring those results in to the FDA, it applies to you too. You want to do one in Australia and never mention it to the FDA? Fine, feel free, have it completely unsecured. But the FDA wants to see that even for the IDEs, so IRBs. So this is a lovely little diagram created by one of the working groups of HISAC that talked about the software development lifecycle. When I started in this industry, that's all we had. We would come through, we would come up with the concept, planning, get funding, requirements, design, development, V&V, release it, throw it over the wall, as we used to say, and into production and sales, and that was the end of it. We were waiting for the next development project. We just didn't care. Okay? Well, there's a whole lot more you have to do these days. Some of the things you have to look at now are these other two bubbles that go on asynchronously with any development that's going on. So say, for instance, down here in the bottom of this, you're sitting there doing, once it's released, you take your software bill of materials, that's your list of third-party software components you used in the device, not the compilers, not the Windows workstation that it was compiled on or Linux or whatever, but what actually is included in the medical device. Versions of that, where it was sourced from, what the dependency is in it, that's all in your software bill of materials. This is a machine readable document in JSON or XML format. There's a couple of standardized formats. This goes out and feeds in and goes ongoing, constant post-market surveillance looking for disclosed vulnerabilities. Somebody's going, oh yeah, that open SSL library you're using, it creates Heartbleed, okay? You've got problems with that. The reason for this is really twofold. But the two big use case conditions are your end users, the HDOs, have no visibility into your black box. They don't know what they're plugging into their network. They have no idea, yet they're the people that are going to take the harm. They're the people on the trenches. Sure, you may suffer some financial or reputational damage as a manufacturer, but they're going to lose millions if they go down, and a lot of them have lately. So they want some way to look at that and gauge that. Last year, third-party supply chain attacks to those kind of software components increased 400 and some odd percent. This year, it's 650% increase, okay? This is a big area for attack, is poisoning the well on third-party software components. They're no longer just going out and saying, oh, you've got a vulnerability. It's somebody contributed to this project and created a vulnerability intentionally as a backdoor into your system. This is what's going on now. Bad stuff. So you get to stand there and look at this, do your risk management, do your root cause, see if this affects you as you've implemented it, possibly reach there and come up with coordinated disclosures and software updates that you can push out to the HDOs. Likewise, as you have those disclosures, you feed it back into your approved supplier list in your ASL. And you go, we've used Adobe for these releases and they've been slow. We do our IFU that we use Adobe plugin to do this. And they've been slow to inform us, slow for patches. We're kind of tired of them. I think I'm going to use Sumatra here on this next one, or at least find another candidate for it. Somebody who will work with us, somebody who'll do fast updates, somebody who will inform us. You want that partnership with your third-party software suppliers. So that's the kind of thing that goes in. That feeds back into the next projects as you go along, go forward. And then on the HDO side, as I mentioned, there might be mitigations that go into deployment and operations, and you're going to, part of the contract language again, help them You're going to have people designated for this. How do I roll this out? How do I do it in a way that's secure? How do I stage this into my organization if I have a few thousand of your devices? And one of the ones that I really love is the one in orange up there, security artifacts. This goes into pre-procurement, which is these HCOs now want to know what they're getting before they buy your package. So one of the things they've started to do is to judge your cybersecurity maturity level by requesting your MDS2s, which is a spreadsheet with about 340 questions in it about how you develop that product. It's free. Anybody can go download it, take a look at it. It's pretty easy to work with. So MDS2, or squared, really. We always call it 2. And the other one is software bill of materials. And if you go, hey, give me a week, I'm going to get that to you, you're already off the candidate list. What they're looking for is you have this, it's sitting in the drawer, sitting in a folder. You can give them a URL, you can email it to them immediately. It shows that, oh yeah, you're on top of this. I'm doing the things I'm supposed to be doing. And so it now ties back to sales, boys and girls. This is where it's headed. If it affects the money, it affects our industry and it's going to get attention. The next thing that's coming, I know because I'm on the working group for that too, cybersecurity labeling. Singapore has already implemented it as part of the executive order that was issued. We will be implementing it as well. How we're going to do it, we don't quite know yet. We're kind of, at the moment, it's very early days, but we're looking at things like how do we know this device is secure? What is our security development process in our organization? And what does privacy look like? In other words, your patient data on this. How much control do I have? Those 3 pillars are kind of starting to shake out. We'll see where it goes, though. Singapore did a nice job of it already. They have theirs already out and going. It's a 4-tiered system, very nice. But we'll see what we do here. So those are artifacts that are going to affect your bottom line because you're not going to get the sales if you don't have them or if you look badly in them. So I like those because that means that gets everybody's attention. So good old 62304, an antiquated how to develop software for the medical device industry standard, has the big V here where you start off with your system level requirements and decompose. And then on the ascending side of the V, you do all the implementations. You test all the implementations that were done. Great. This should come as a surprise to nobody. But how do you overlay security work into this? Well, basically, you need to have a security plan. This can be a separate artifact or part of your project plan, but you're going to lay out over the course of the development of this device, what activities am I doing it? Who's doing it? What relative phase are they being done in? Right? You know, a plan like we do with everything else. Okay, it shouldn't come as a surprise. Then early on in the design phase of the product, you're going to do a form of threat modeling. It's called a vulnerability assessment. Again, I'm sorry about the terms. It's like what threat is not a vulnerability, I know, but threat modeling caught on. So you take your system, you decompose it. For your use cases, you will identify the high scoring issues. I'll get more into that in a second, what that looks like. But that gives you that. Now, what is a design vulnerability? I keep talking about these 3 different vulnerabilities. You didn't encrypt PHI. You're not protecting your cryptographic keys. You're hard coding your cryptographic keys. You're not authenticating a user. You're not authenticating another device connecting. Those are design choices you made and made badly. Okay? Implementation vulnerabilities are, I'm not checking a buffer length. I'm using an unsafe intrinsic value that I can attack with a side channel attack. Those are implementation. Different tools, different techniques. But the vulnerability assessment only works for design vulnerabilities. Then what you find in that, what are the high scoring ones, we expose in a security risk management report. For those who know that terminology, that comes out of the AAMI, AMI's TIR 57 document, one of the better documents out there for cybersecurity. That and the Joint Security Plan out of the Health Sector Coordinating Council are the 2 best documents to use when implementing security in your organization. They're both excellent. All right, pick and choose between them, by the way, what parts you're implementing. But what that security risk management report shows is all the high-scoring vulnerabilities. Then inside that same document, you trace to the mitigations you're going to use. This is the document that is used to step off to the rest of your document tree, requirements, detailed design, risk management, everything that you're going to use for traceability. You don't trace back into the VA. You only go to that document. So it's the output of the vulnerability assessment. Then during implementation at the bottom, concurrent with implementation, we do static analysis, of your source code, SAST, that's looking for insecure coding practices. If you look at Cert C, for instance, since C is still the big lingua franca of our industry, there are things you should and should not do. There are rules that you should do. SAST is kind of like lint. It scans through and looks for those. And if it finds them, it reports on them to you. So you can go out and fix them. Fuzzing, that's applying random structured data to your communication ports. All right. That could be a serial port you've exposed. You got a console going on there. That could be Ethernet, Wi-Fi, Bluetooth, med radio, inductive, doesn't matter. You do fuzzing against that. It yields so much fruit. It's one of the go-to attack surfaces we use. It's amazing how easy it is to break most systems that have not been subjected to fuzzing. Unit testing, well, in particular, one form of unit testing, 62304 has a lot of them, including code coverage and all that. But for cybersecurity, we're only interested in boundary analysis. You have values that are used in a unit or passed into a unit. You've got a signed in 16, and typically it has a value between 5 and 1,000 in it. What happens if it has -4? What happens if it has 32767 positive? It stresses it to see how you've handled those exceptions and see if it breaks it. And then penetration testing or pen testing. Normally, this is done at the end of your development lifecycle. The problem with pen testing is when you reach that, if you did it just before you released it, or you're about to go into V&V, you hand it out to security researchers. 6 to 8 weeks later, we come back and we give you a 100-page PDF of all the design and implementation mistakes you made. So you're going to go back to your management and say, oh man, we screwed up. I need another year and a half and $5 million so we can make this secure, right? You're all going to do that, right? No, you're not, because you won't have a job the next day and you all know it, okay? You're going to go to market with this and try to get this through and pretend nobody's going to see it, and then it's going to be a big problem. So don't do pen testing at the end when it's worthless what the results are. Instead, do it concurrent with your implementation. This goes back to your plant because you're going to go through there and say, oh, I'm prioritizing that Bluetooth low energy interface. Why? Because I want to get that out there and I'm going to scope a pen test against just the BLE. Somebody like me or security researchers, I'm not going to go look at your user interface. I'm not going to go look at your Wi-Fi. I'm just going to BLE. And then when you get the Wi-Fi, okay, we're going to attack that. Okay, and then we're going to do a physical attack against the base unit. Okay, so we walk through it and we do a series of pen tests that wind up with the same coverage. The advantage? It's 2 weeks after the implementation guy's finished with it. We're feeding it right back into your bug tracker, feeding these things back into you. So the team's still there. They haven't quit. They haven't moved on to other projects. And more importantly, they still have the concept in their head. So they can take this and go, oh, yeah, we didn't do that. Okay, we need to go fix that buffer overflow issue, for instance. So that feeds right back into that. So those are the things you should be doing concurrent with your coding. Static analysis, run early, run often. My company, we can do it for you. We'll charge you for it. We use Parasoft's SAST. Great. It's one of the cheaper ones. It does a good job of it. However, I can show you ones that cost 10 times as much, that have much prettier displays, but they're all good. I highly encourage you to bring it into your own house, because if you have us do it, we're going to do it 1, 2, or 3 times during your project. This should be included in whatever your build cycle is. You want to eat this elephant in small bits. Literally here 3 weeks ago, we had a client that came in with a piece of code. They had 60,000 rule violations. And I'm like, I don't like giving that kind of news to a client. They don't like hearing it. It's like, I'd have much rather they, as if they were developing it, had nightly builds and went, oh, here's another 6 problems. We had rule violations. We need to fix those tomorrow. That's approachable. 60,000? 60,000 isn't approachable. It's your code is crap. So do it early, do it often. Email me, get me on LinkedIn. I'll tell you which ones to use. I'll help you along that way. Lastly, the only thing here that isn't required by the FDA is the system security report at the end. It looks a lot like your security plan in that it calls out all the stuff you did, but then it talks about the number of vulnerabilities that were detected, any false positives, any false negatives, okay, how you mitigated them, if there was any residuals that couldn't be, and a risk-benefit analysis for those residuals. It's a great place to go because the FDA likes to see it. It makes them warm and fuzzy. They don't mandate it, but I'm telling you right now, it's a great thing to hand them one sheet of paper or one document that lists all the things that were done and the summaries of it. Might they still tunnel into something and say, oh, I want to see that static analysis? Sure, that's their right. They can do whatever they want. But you don't want them to start with, here's the static analysis reports. You don't want to go there. It's much easier to show them the end result of all your work. This will make you look more mature. This will make you look like you know what you're doing. Likewise, in that same system security report, you're going to put a written human readable software bill of materials as opposed to the machine readable flavor. And at that same time, if there's anything that's not a current version, you're going to disclose any known vulnerabilities and again, why they aren't a problem in your device. It's much easier if you've been working on this for a year and a half and your third-party software components have had new releases to go out and just incorporate the new releases than try to justify your way out of a real problem. I usually recommend that as the first step, but if you can't, they've changed the API, for instance, enough that it would make me a large code rewrite, then we're going to spend a lot of time on that risk-benefit analysis for the FDA. And then, of course, once you do get approval and you're out in the marketplace, you're doing post-market surveillance and analysis on an ongoing basis like we covered before. So this is this eye chart, which you can all plainly read, I'm sure, from there. It gives you an idea of the activities and the artifacts that are created in a typical development lifecycle, from research up front into the development lifecycle and into operations as you make it. So let's zoom in a little bit on this here and highlight some stuff that are artifacts that come out during the development process. These are the cybersecurity artifacts you should be creating. These will be the things you will include in your pre-market submission to the FDA, so they will approve your product. If you don't, they will start asking you questions. By the way, in that system security report, one of the things I do is I get ahead of the game. I don't want questions. So let's say I have Bluetooth Low Energy. We'll pick on that because pretty much every medical device these days does for some reason. There are 8 known really bad vulnerabilities for BLE. All of the security over-the-air modes have been violated. The FDA is fully aware of this. So as opposed to trying to hide it, you go in there and you call out all 8 of them and say, this is how I've mitigated it. A, it shows you know what you're doing. B, it answers all their questions and they don't have to come back and question you about something. And they just are going to move on. Right? I did a pre-sub meeting from one of my clients here about a month ago that had BLE in it. And the reviewer, clever guy, comes back and goes, how are you doing authentication? He says, oh, we're doing a challenge response. We're doing over-the-air just works, in other words, no security for BLE. And then we're only doing our own level of challenge response using 128-bit HMAC. I'm like, oh, excellent, wonderful, done. Okay, so where you can, give them the answers they're going to ask ahead of time. They may not go farther with that then. If you come back, and I've seen this mistake made, questions from a submission, what level of encryption are you using? I'm using SHA-128. Okay. Nobody's burying their heads. So let me explain to you. SHA is an integrity check. It's not encryption. It's like saying, what car do you drive to work? Oh, Boeing 747. Kind of missed the point. They're both cryptographic, but that's not at all. Those kind of responses mean they're going to tunnel in deeper into you. Okay, and they did, by the way. They tunneled in nicely into this company to the point where they shut down manufacturing on it for a while. So you got to be careful what you say. Volunteer it up front. Celebrate your successes. If you've done a good job, celebrate it. It's only going to get this thing approved better, and they're going to think highly of you. So once you're in operations, what do? Post-market surveillance goes on. Okay, you do patch management as you go forward. Restate this during design phase. You do a data flow diagram of your topology and your custom hardware. I'll show you more details on that in a second. Using a systematic process like Stride, created by Microsoft. It takes that template, automatically decomposes it into a list of potential vulnerabilities. You then go through and score those vulnerabilities in light of your use case. You also identify patient risk from business risk at that point. That scoring can be basically anything. I recommend CVSS version 2 because it has both exploitability and severity in the metrics, but you could do just severity and exploitability separately. That addresses for your use case what risks you are. So let's say I'm making an automatic external defibrillator, AED. You know, everybody knows what AED is. You see them in the airports on the wall, right? Keeps people alive. Great medical device, by the way, really saves lives. So I'm broadcasting the battery life out of that AED. Does anybody care about confidentiality, integrity, availability? Nope, you really don't. That BLE just broadcasting that battery life, it's like, oh, it's a nice to have. But what if I could adjust the amount of energy that was delivered on the next shock event? What if I could actually trigger a shock event over that BLE? Same BLE interface, but my use case was different for it. All of a sudden, it takes on a lot of criticality. So you have to have a way to automatically decompose your system, expose the potential vulnerabilities, score them in light of your use case, and see these are the high scoring ones we need to fix. Okay. The process of STRIDE, because it's abstract, is going to result in about a 30% false positive rate. I'm working on ways to improve it. I literally at this moment have at University of Colorado Boulder a team of PhDs who are working on a new approach to doing this that will be completely automated. Okay, so it takes it completely out of our hands. This kind of a process of doing this VA work up here takes 40 to 60 hours for us. I want to make it in minutes, and that's what we're working on. So you mitigate those vulnerabilities, and then you rescore them in light of those mitigations, and hopefully you brought the scores down substantially. Anything that doesn't is residual, and that's going to expose in your system security report and explain why this isn't a problem, why you're not going to harm patients. You're going to document all of this in your risk report or system security architecture. It depends on which document you want to use. That goes out and traces out to your product requirements docs and out into your risk management if it has something to do with patient risk. So I'm a security researcher, and I said, wow, I've discovered a denial of service attack. I can keep your device from delivering essential clinical performance for 10 minutes. Okay, I'm patient risk, right? I'm going to knock that over to the risk management team. And they could go, yeah, we're making a ventilator. That's kind of important. The patient's not going to hold their breath for 10 minutes, okay? Or no, I'm making an insulin infusion pumps and 10 minutes of interruption is not a big deal. Kick that to the people whose job it is. We flag it, we let them look at it, and they make clinical assessments about it. You want the experts to do their job. Don't think you know everything, because we don't. So that data flow diagram, this is what one of them looks like for a typical medical system. So you create boundaries here, like here, that show a medical device, BLE in, patient controllers, okay? Maybe it's got a legacy inductive wand. All of a sudden that looks like an implantable, all right? Interfacing out to a Windows 10 tablet, SQL database, that's how you do it. That will generate 112 potential vulnerabilities that you're then going to go through and score, all right? Pretty straightforward, actually. It goes pretty quick. That is created by Microsoft, and it's called the Microsoft Threat Modeling Tool. Like I said, hopefully my team at University of Colorado Boulder is about to replace that, so with something a lot more workable. During implementation, we do fuzz testing, micro-penetration testing, as opposed to full penetration testing, security static analysis, unit boundary testing. We do create reports on all of those because nothing happens if there's not a report. All goes back into bug tracking. This is per sprint, per build, per milestone, however you want to do it. And it's ongoing throughout your implementation phase. And then lastly, as you go to submit to the FDA, and for the supported life of this device in the market, you're going to take your machine-readable software bill of materials and reference other things like the National Vulnerability Database, vulners, ISAC security intel reports, threat streams, even media outlets, and directly contacting the manufacturers of them. All right? You're going to feed that all in and look for disclosed vulnerabilities. You're then going to review the impact on your product, root cause analysis. Is this really a problem of ours? You used OpenSSL 1.1.f. They're going to go, oh, it's susceptible to heartbleed. No, I'm just generating random numbers with it. I wasn't using it for certificates. I wouldn't do anything with that. I didn't even compile that code into my code. So you can have false positives show up just because of how you use that third-party software component. And then as you formally do this every 3 months, the reality is we do it daily because we have it all automated. So we alert our clients, because we'll do this as a service for you as well, but I strongly encourage you to do it inside. It will alert you as to something that could be a problem. Here a couple of months ago, we had a particular Bluetooth chip that without pairing with it, you could cause remote code execution on the device. There's a lot of implantable devices now that use BLE. If without even connecting to it, in other words, you didn't get a chance to do a challenge response or anything, you can cause that thing to remotely execute your own code, and in this case, deliver shocks. It was a neurostim. Right? It's like a day and a half after it was disclosed, I was reporting to our clients, you got to get ahead of this. Because sure enough, all of a sudden the DHS and the FDA and everybody gives you those calls and they want to know what you're doing. So this gives you usually about 2 weeks of time to get your shit together so that you know how to answer that as to, we use BLE in that product. So that's the kind of thing you want to do. You want to get ahead of this, figure out if you're really affected. If you are, what do I need to do about it? Is this a recall? Is this going to be patchable? How do I need to get ahead of this whole thing? So as I was talking about the supply chain, tomorrow here I'm giving a lunch and learn that's close to 2-hour lunch and learn on supply chain mitigations. And it's going to focus on software bill of materials. I've worked on software bill of materials with Department of Commerce, NTIA, for the last 3.5 years, defining it. It's the one the executive order is now applying, exactly what we created for them. We exercised just about every use case and edge case we could come up with in those 3.5 years. So interesting stuff, but I'm going to talk about in general the supply chain. There's a lot of risks. Going forward, we now need to mitigate those risks, both external and internal to your development organization, and then as you hand it off to manufacturing. What do those look like? What things do we have fixes for today? What things do we see having fixes for tomorrow? And what are the things that we don't know when we're going to get fixes for? And there's a few of those still. So really kind of complex. I invite you all to come in there. It's 152 is that way up the escalator if you're interested in being there tomorrow. So if so, I'd like to see you there. And I was supposed to have somebody here to walk around with the microphone. There she is. Hi, Lindsay. Are there any questions?
Great talk. Thank you very much. There were two standards you mentioned that were like two guidances.
Yep.
And the joint
right.
Something.
The two standards, AMI, AAMI, you don't want anybody to think it's AM1. AAMI is TIR 57. That's the development one. They also have one called TIR 97, which is post-market. Both are good. TIR 57 is a little bit better. The other one that is actually my favorite, and I don't say that because I had nothing to do with the creation of this document, so it's not like my personal baby, but that's the Health Sector Coordinating Council, or Health Sector, HSCC, okay? And it's the Joint Security Plan, which is usually abbreviated JSP. Both are excellent documents. There's a lot of them that are out there. There's one in particular that was trying to harmonize international standards. Absolutely terrible, completely unworkable. They didn't even have consistency in terms throughout the document. Somebody cut and pasted from Australia, EU, MDRs, and United States. It's like, great, adding more confusion. Welcome back to the 2014 free market guidance, right? It's like, no. We need stuff that helps us, gives us guidance. So if I was starting out wanting to do this, I would go with the Joint Security Plan and follow it. The FDA was involved with it. Suzanne Schwartz, she was very involved with the whole thing. And so, and besides, the HSCC is a great group of folks, skilled people in every working group, all geniuses and people that are movers and shakers in this industry. So